Welcome into No Scrubs, a Vet Med podcast. My name is Grace. I'm a third year veterinary student and the owner of the Acceptance Lab. Today, we're joined by two amazing veterinary technicians, Miranda and Lindsay, and the topic today is veterinary medicine, life as a veterinary technician. Welcome in. So, to get things started, Miranda, can you share a little bit more about how you got into the field of veterinary medicine as a technician specifically?
I feel like with most, I love animals. Who doesn't?
Of course.
But so I got a Dalmatian puppy, as a first birthday present. And so I feel like that started my love for animals. We grew up together and I had her for 16 years. So all through high school, or the majority of high school. And I knew that I wanted to go in some kind of field with animals, but I thought that the only field was to become a veterinarian. I didn't know that there were technicians licensed or not. I didn't know that there was really kennel people, or assistants or anything. So I literally just thought, if I love animals, I need to work with them. I must be a vet. Only option.
Yeah.
I feel like most. And so I kind of went around with the idea of going to vet school, but I also didn't know. I wasn't 100% confident in myself. I didn't know if that was the right route for me, for various reasons. And so I was like, well, I've got to get my foot in the door. I had a dog growing up, but we never regularly took her to the vet.
Fair.
So I wasn't exposed to any of it, so I really had no idea. So I typed up a resume and a cover letter, and I literally sent it to pretty much every clinic in my area, within like a 45-minute drive, and was just expressed, who I was. I wanted to go to vet school. I just need to get my foot in the door. Do you have any openings? And so one reached out, and it was like the week before Christmas. And they were like, yes, we need a kennel person, because what busy clinic doesn't need a kennel worker
Over Christmas.
for Christmas? And
Of
so
course.
I was like, absolutely, I'll take it. And so I started there. And so I worked in the kennel in a really busy multi-doctor private practice GP. And very quickly realized there's so much more than just a veterinarian. So I started in the kennel as a kennel worker in December of 2010, right after I graduated high school. And then really just found the technician program, um, got accepted into Gwinnett Tech. So I was local. Got accepted into the program at Gwinnett Tech, and they take, at the time, 30 students. And so I was one of 30, went through the program, graduated May of 13, and became licensed October of 13.
Awesome.
So I've been in the field since then.
That's amazing. And I think, a lot of people, just as you said, don't really know what role or what capacity they want to step into the field in, but they know that they have a passion and they know that they have an interest. And just by shadowing or experiencing and working in the field in some capacity, it really opens up your eyes to what you really can do. And Lindsay, same for you. What kind of got you into the field?
Yeah, so again, I love animals. I think that's a common theme, and it should be. So I was actually born in a small town in Ohio, and I would bring animals home. Sometimes not knowing that they were my neighbors.
Right.
And so that was always my parents' joke, is that they knew I was going to work with animals because I would literally just bring them home all the time. I had a dog and it didn't matter. I was just like, oh, that dog obviously needs a home, so I'll take it home.
Right.
And then we moved to Georgia when I was 10 years old, and I'm just a little older than Miranda. Luckily not much. But my introduction to UGA was through the UGA marching band. I was big into band. And so I knew that I wanted to go to UGA for college. And like everybody else, well, the only way to work with animals is to be a vet. So that was always my thing, is I was going to be, my dad called me Dr. Doolittle. I could always care for everything. I had horses, bunnies, goats, a duck, dogs, cats. We had it all on our little property in Georgia. And so I was always going to be a vet. So I applied to UGA. It was my first choice college. I was first round acceptance. And then I got to UGA from kind of a smaller town in Georgia, and it was a lot. It was very overwhelming. I was a come home every weekend girl. I commuted for roughly the first 2 years. I joined an agriculture sorority my third year, which really saved my college career. So I was still going with like the intention. And then as I'm doing this pre-vet program, I'm just like, I just don't know, right? Like, this does not feel like me. I'm not a straight A student, right? Like I'm smart, I don't test well. Organic chemistry and I, not friends.
Me neither.
I was like, if I can't hardly
Me
make it through the
neither.
first one, right? It's like, I mean, it's hard, like it's a weed out course. And so I just really struggled because suddenly academics were so hard, but it was because of the classes we were taking in order to go to vet school.
Right.
So I did a victory lap in college, graduated in 5.5 years.
Right.
But sometime during that, I had worked for a couple of vets. So our small town vet back home, I was working for him. He was a single doctor practice in a smaller town. There were only 2 practices in the whole town, both single doctors. And so there were vet techs in the practice. And so I was a vet tech. And I was like, okay, well, I don't really know what that means, but sure, sounds great. Then I moved up to Athens during college and started working for another veterinarian. And that's where I was introduced to my very first licensed vet tech. She was finishing her program at Athens Tech.
Cool.
And I was like, whoa, 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 this is a thing. And she was like, yeah, you can go to school for this. And I was like, oh my God, what are you talking about? Well, I was already 4 years into college at UGA and I was like, well, I'm finishing at UGA. So I did, and then left that practice, was jobless for a little while, randomly applied for a park assistant job with Athens Clarke County and got hired on as a zoo assistant at Bear Hollow Zoo.
Cool.
So then I thought, well, that's really cool. Like
Yeah.
these are a totally different set of animals than I've ever worked with before. I have a lot of large animal experience, not like extra large animal experience.
Yeah.
And while I was there, and this is what really like set my path for me, is Bear Hollow was contacted by the Georgia DNR about 2 orphaned bear cubs. Anybody in the Athens area is familiar with them. And I was given the immense opportunity and joy of helping raise them from bottle babies to full-grown girls. And I've never been a maternal person. I'm not like, oh, I want to birth a child and be a mom. And I saw these 2 bear cubs and I was like, nobody is causing them harm. Like, I will throw down with you. You are not touching these babies in any way that causes them pain. So I was working at the zoo, having a great time, getting these animals to trust me, which is really something I want to touch on later with some of our questions. And these bears trusted me. And I was introduced to the 2 behavioral medicine residents at UGA because they wanted to come out and train the bear cubs. Everybody wanted to be involved with these cubs. And so we spent the next like 6 months to a year teaching them to do different things husbandry wise. And I was like, I'm sorry, you can train animals for veterinary things. Like, this is mind blowing to me. Like, you got to be kidding me. This is amazing. If I can get a bear to stand there for an injection, like what are the possibilities here?
Yeah.
So I literally toyed for a while with kind of going that route, like the zoo route of training and husbandry and everything else. And then UGA approached me because their technician at the time was going out on maternity leave and they needed somebody temporary part-time, 6 weeks, right? I was like, cool, yeah, I'll do that. Like, I'm out of school now, I need some money. And then I just kind of tripped and fell into the position I'm in now. So I've been at UGA for 15 years. I started as a vet assistant in the behavioral medicine service. Then I part-time, and then I got full-time hours. So I was working with the primary care practice in behavioral medicine. And then I realized I'm going to go nowhere at UGA being just a vet assistant. Like, there was not a growth program for assistants at the time.
Right.
And so that's when I, with that previous technician that I worked with that was licensed, I was like, okay, well, I'll go to school. But at the same time, I was fully on my own, full adult, late 20s, getting ready to start yet another school program.
Yeah.
So I opted for an online vet tech program. So I did school online. It was very hard. Miranda knows because she experienced every single moment of it with me, where I had to do skills videos and checklists and whatever else. So it took me a lot longer because it's hard to be working full-time and going to school full-time. So I did eventually get my associates. So I have a bachelor's and an associate's, and I graduated 2019 from my tech program, passed my state boards that fall, became licensed in January of 2020. And then just been keeping on ever since. I decided I wanted to be a specialist in behavior before I really decided that I wanted to be a licensed technician. So when I was able to do that with my hours, I pursued that, and I just got that 2 years ago. So I'm now a veterinary technician specialist in behavior, and I have zero regrets. Like, it was a long, convoluted, different way to get there.
Yeah.
but I realized in the process that I didn't want to be the doctor.
Yeah.
I wanted to be the nurse. Yeah.
Yeah, I think that's super fair. And what's really interesting is hearing both of your paths. They're so uniquely unique. You guys were on totally different paths, but you've kind of ended up in the same place and in somewhat similar positions. And so I think that that really speaks to the breadth of what the technician position really holds, that you can do so much and you can go as far as specializing or you don't have to. You can work in private practice or you don't. I think that's amazing. Something that you both kind of alluded to was the difference between assistants or using the term assistant versus technician. If you wouldn't mind sharing a little bit more on the differentiation between what these two roles are, in case any of our viewers are confused between the two.
So, kind of in a nutshell, an assistant is an on-the-job trained veterinary assistant. Technicians, if you want to be some states have title protection, where Georgia is not one of those that has that. So, is my understanding. So anyone in the state of Georgia is like, oh, I'm a vet tech. But in reality, in order to be a licensed veterinary technician, you have to go through an AVMA accredited program, graduate from that program, sit for the veterinary technician national exam, pass that, sometimes take a state licensing test, put in a big application for them to give you a license to say, yes, you can be a licensed vet tech. So veterinary technician, and then keep it up. Like you have to do CE every year. You have to do ethics training every year. Like you have all these things that you have to do in order to keep your license active. So veterinary assistants are trained on the job, not saying that they're any less than, because we have several now technicians at the hospital. And I actually looked it up because I wanted to make sure, but there was a clause in Georgia for a while where you could be grandfathered in, where after so many years of working or on the job training, you were allowed to sit for that exam without having to graduate from an AVMA accredited program. I believe that ended in 2009. But we have some technicians that I work with that's what they did. And one of them in particular is in anesthesia. Smartest person I know. I've learned more about anesthesia from this person than anybody else. And he never went to an approved, like a AVMA accredited program.
Yeah.
But he knows his stuff. So you can be grandfathered in sometimes, but generally an assistant is on the job trained, whereas a veterinary technician is through a school program. I think the way that you learn is a lot different. So similar to like people who know the path of a veterinarian, you have all these little check boxes you have to have, with like organic chemistry and all of this to get there. But then you also have to do pharmacology and internal medicine and whatever else, right? Like you have all these things you have to do. We had to do that too.
Yep.
So we had to be very specific about the things that we learned in the body and anatomy and all the things. So it's just really more of an assistant nowadays is more on the job trained, and a technician has gone through an AVMA accredited program. And I always tend to emphasize I'm a licensed veterinary technician, because if I just say I'm a vet tech, that could really be very obscure because people don't understand the difference.
Exactly. And I think that's great, really emphasizing the licensed portion of your role. And as you mentioned, there is title protection. So some states, you cannot call yourself a veterinary technician without holding that license. Whereas other states, there isn't the title protection. So there are some individuals that just use the term interchangeably. So that's very, very helpful. And then how long were each of your programs that you participated in? I know, Lindsay, you mentioned yours was online, but what did those programs kind of look like for each of you? And then was that program that was online coupled with any clinical skills kind of benchmarks that you had to reach as well?
It's a 2-year program. It was taught by Dr. Ballard, in Georgia, obviously. But it was a DVM. I think I don't know all of the rules and laws now, but I think in order to have a program, an accredited program at a college, it has to be run by at least one DVM. So a DVM has to be on staff. And she was our primary. So we were being taught by a DVM. And so, of course, she was honing in on all of her little things that she learned and all of her particulars. And
High standard.
I couldn't help but think, is this what every program is like? Or
Right.
are you training what you would want your technicians to be at
Yeah,
your practice?
fair.
But we had to do A&P, med terminology, pharmacology. I feel like the summer semesters were our labs. So we did like a blood and urine. So we learned all about everything. I mean, I feel like honestly, it was like a mini vet school in 4 years, shrunk down into 2 years. And so we did all of that. And we were in the classroom Monday through Friday, as soon as we started. until our second year. And I think second year fall semester is when we started doing internships. I think it's what either intern or externships is what they call them. So the program had like a partnership with all of the clinics locally. Um, and so what they would do is you would apply or kind of go through and say, like, this is your long list of clinics. Which ones are you interested in? And they had small animal, large, exotics, mixed. We could go down to Emory if we wanted to, and do lab animal. And so we kind of, like vet school in a way, we had to pick what track we wanted. And so we all learned everything all at once. But then when it got down to the nitty gritty, if we were just small animal, then we chose all the small animal practices.
Gotcha.
And so then we were sent out on internships. And so we were there maybe 6, 7 weeks at a time. And they were all local. So a lot of us obviously lived at home. And we would just commute back and forth. But we did that for, I think, the fall semester of the second year. And then spring semester was like most, it was January to May or January to April, and that was the big externship. And so then we could choose one place that we wanted to go for 4 months. And basically we worked there for free. And so we got a lot of hands-on experience. And the clinic was your choice. If it wasn't on the approved list, then you just had to reach out to that clinic, ask if they'd be willing to, have a student. It had to be approved by our instructor because she sent us with, I will never forget, it was like a legal size document, front and back, of all of the skills that we had to complete when we were at whatever clinic we were. And so it was all these little itty bitty check boxes. And if you completed something like restrained an animal, restrained a dog, a cat, did an x-ray, client communication, literally anything, every aspect of vet med, we had to go and we had to check it off. And then we had like an instructor or a point person at that clinic, and they would approve and they would initial every single little box and said, yes, you did all of these things. So it was a
But that's
2 year
what made you
long.
great. That's what made you great.
Right. Very meticulous.
Yes.
But in a nutshell, it was a 2 year program in classroom most of the time in the beginning. We did not have animals on site, and so a lot of it was just textbook things. We really did all of our hands-on, either at UGA. So because we didn't have animals on campus, all of the large animal stuff we outsourced to UGA. So we would all go on field trips. And we did a day at UGA. We did not go to the aquarium, so I think that was a little bummer. And then we went to Emory for our lab animal experience. And then the rest of it was just hands-on in clinic working.
Awesome.
And I will say, so she went to one program, the program here in Athens at Athens Tech, and several other programs in the state of Georgia actually have a contract with a teaching hospital where they send their students for their last semester to get their clinical experience. So some schools choose to do it with individual clinics that have been like approved by the AVMA within the program and everything else to allow this. And then others go through a teaching hospital for their clinical rotation. So it may just depend on,
Like
which school you go to and what contracts they have set.
Yeah.
Awesome. Super
Yeah.
cool.
And then for the online program, it's kind of the same thing. It's designed to be a 2 year program if you go full time. But working full time and going to school full time is very hard.
Yeah, I can imagine.
I think one semester I was crying my eyeballs out at work, and my amazing coworkers were like, "You're not quitting," and I was like, "No, I am quitting."
No.
So it's the same thing. The classes are set up slightly different for my online program. So in person, you do like one pharmacology class, one ClinPath class. You may take like a secondary one. I feel like mine had 3 tiers, if I'm not mistaken. So the first one was all kind of book work. So you did like round 1 of all of these subjects. Then round 2 was accompanied with a skills list. And there was a whole process I had to go through with my online school to have my job site approved as a facility. And then I had to have my individual people approved as preceptors.
Yeah.
So then my preceptors had to say, yeah, sure, she can do all these skills. And then my third tier was, then I had to video it. And that was the biggest nightmare of my life. Because it would literally be, I'd have to do a blood draw on a dog, jugular, cephalic, saphenous, on video, whatever else. But it was like so strict that there were several videos that I just had to throw out as soon as I saw them because I was like, oh, there's a person in the background in a sweatshirt. That's not a scrub top. You can't have
Yeah,
that. So the videos were a actual living nightmare. Looking back, I would have done my life a lot differently and not done online tech school. I'm not saying I didn't learn well. It was just for the point in my life, it was just very hard.
of course.
They Miranda was actually one of the preceptors for me. So
There you
she
go.
got firsthand experience
Oh, yeah.
as to how horrific it could be. But I do feel like it made me a better technician.
Yeah, for sure.
So then all the videos had to be approved by our people. And then kind of something that she already touched on was like lab animal, large animal. So many clinics that are available and whatever else, they tend to be very dog cat oriented. For my videos for lab animal and large animal, I could either have gotten with the research department here and done lab animal and then gone to the barns to do large animal, or my school offered a 2-day course out in Texas where we would fly out as a class, stay for 2 days and basically get everything checked off at one time. So I opted for 2 days versus a whole semester of two
Yeah,
classes. So that was neat because then I got to meet some other people and we were literally from all over the United States. So
yeah,
that was a lot of fun. And then just like any other class, you have your final exams at the end of each class that say you can move on to the next level and whatever. But it's designed to be a 2-year program. I did it in 4.5 years, maybe almost 5. Especially when I got to the videos, I really I think I did 1 semester of 2 video classes and I was like, this is what kills me.
ridiculous. Yeah.
I think I'm not going to do this again.
Yeah, I
So,
can imagine the administrative challenge of that, like just even getting things done and
yeah.
everyone being okay with you even filming, even though it's something
Yes.
so silly as just a clinical
Yes.
skill and one blood
Right.
draw, but it's like, oh my gosh, we're busy. How do I do this? Now I have to
Mhm.
take the time. Now I have to take someone else away to film it. Yeah, I can
Yeah.
imagine how that could be an administrative kind of nightmare
And
experience.
the online tech programs actually have a rule. It's set, I think, by the AVMA that you cannot use the same animal for more than 3 things. So for the entire semester, like my dogs were perfect. I could literally do anything to them,
Yeah.
but I could only do 3 things to them. And I'm like,
Yeah.
this list is 30 things long.
Yeah.
Like,
Let me choose the trickiest things
maybe
that I know
the
they'll
hardest
sit
ones are
still
getting
for.
done. Yeah. Yeah. So that was also kind of tricky because even if I had like an animal under anesthesia, it was really hard because I could trim nails and do this and do that and do that. But I was like, but I only can do 3 things under,
Right.
on one patient.
Right.
So even though I was doing all 7 things. So yeah, it's more of a tiered program. And you can't move on from like level 1 to level 2 until you pass all of your level 1 classes.
Yeah.
But I know different programs are aligned different ways. I think Penn Foster does they do externships. So they'll do like some didactic courses, then you do an externship with videos, then you do some more didactic courses, then you do some more externships with videos. So they're all slightly different, but they all involve videoing your skills, which is hard for technologically advanced or depleted people.
Yeah.
So like it was so hard. It was so hard.
Miranda, you've kind of worked in a variety of different spaces, kind of as you spoke to. What I'm really interested in you sharing about is your current role in education and how you pivoted into education in the first place. Is this something that you always wanted to do, or is this something that just kind of fell in your lap? Do you mind speaking a little bit more on your current role?
I feel like it fell into my lap. Um, and honestly, I think it has a lot to do with Lindsay. I graduated and from my program went straight into private practice. Worked at a GP there for 2 years and loved it. Never really imagined myself leaving. I also, at that time, never thought that I was going to go to the ivory tower, and go into working at a teaching hospital. I think it went back to the whole self-confidence. I didn't think that I could do it. Like Lindsay said, you always worry about your grades, and I didn't think I was good enough. I didn't think that I could be at the very top teaching other people how to do it or work in that field and not really know it myself. And so I didn't give myself enough credit. So in the beginning, I never thought that I was going to make it. Didn't think it was a possibility. But I was in private practice and I loved it. It was a 24-hour day, an emergency, and I had the best of both. So I had a split shift and I worked 1 week, mainly days. Normal, I think it was like 7:30 to 5. We didn't do any boarding or kennel, so that was nice. And then the other week I did daytime emergency. And so it was great. But then after 2 years, I realized that I really couldn't go up. There was no room for growth. And even though I loved the doctors, the practice, the medicine itself, I wanted more. And I didn't really know what that looked like. Um, but that was in 2015, and that's when UGA got their new VTH. And so, as you can imagine, they were advertising like crazy. And so I think every RVT in the state of Georgia got a letter saying, hey, UGA is getting a new hospital. They're opening up a whole brand new department, the IMC or intermediate care. And they had like a job fair open house. And I went with it. And I was like, why not? Let's just try. And so I signed up to go to this job fair, and they gave a tour of the hospital. It was not yet complete because I think this was February of 2015. So it was kind of behind the scenes, which was nice. Um, and I decided to do it. And so I applied to pretty much every position that they had open. Didn't get a call back at all for any of them. And I was like, okay, well, me and every other RBT in the state of Georgia
Yeah, it's trying to come.
just applied.
Yeah.
So, okay, great. Um, and then somehow my information, I think I ended up going online again just to see what the other positions were open, like what they were. And I found one at the community practice clinic. CPC is what we called it. And I was like, well, this is perfect. This is literally what I'm doing right now, just in private practice at the VTH. This is
Yeah.
great. So I applied and I interviewed. And Lindsay has heard this story so many times, and it's so fun. Came here, interviewed, didn't get it. And I was like, okay, well, this is just my sign. I guess I'm just gonna stay a private practice. But no, that's not how it works. So the VTH
Never.
never. Small animal emergency in general, ECC, ICU is always hiring.
Yeah.
Always hiring. So my information got passed to the small animal department, and lo and behold, they were hiring an overnight tech position, strictly overnights. And I had not worked overnights ever. I worked emergency, private practice emergency, but private practice emergency and UGA emergency is completely different on a whole nother level. But again, I knew I wanted more. And so I said, sure, I will attempt it. Interviewed, had a phone interview, and got it. And started July 1st of 2015, working overnight emergency. I wasn't yet married. I didn't have kids. It was just me and him. And so I was like, this is perfect. Why not? So I did that for 11 months. And I learned a lot in 11 months, but also learned that I did not want to work overnight weekends for the rest of my life.
That's crazy.
That's
So, how dare you?
That's
What the heck?
Because my schedule was Friday through Monday overnight, 8 p.m. to 6 a.m. And there was really no possibility of switching, unless I was there for 5 years and then seniority, and then you get a different shift.
Yeah.
So that position at CPC that I had applied for the first time opened back up. And I was like, oh my God, this is meant to be. So I applied, I re-interviewed, I came back to the clinic, went through this whole process like I had 11 months prior, and I got the job.
Let's go.
And so I was there for 8 years, and loved it. And that's where I met Lindsay. And honestly, I felt like this was my spot. I was able to fulfill the bigger dream in me, I guess, of doing more. So it's not a GP because it's not private practice, but it's essentially like a GP would run, with it being a part of the teaching hospital. So I was still doing regular appointments. I was still helping in surgery, doing anesthesia, all of the things that I normally did, but I was teaching the fourth year vet students along the way. And that's when I was like, okay, this is, I think, what I needed, that I didn't know that I needed. And then when Lindsay went through her online tech program and I really helped like teach that, I was like, well, this is it. Like, I really find joy. Not every single aspect of teaching is great. Not every topic is great, but I really did find joy in doing this job as a licensed tech, but also teaching people along the way.
Yeah.
Which then leads into my current position. So I transferred from PHC, Pet Health Center, CPC. It now is a different name.
Yeah.
So I transferred from that role almost 2 years ago into clinical skills. And so now I work, instead of with the fourth years, I work with the first, second, and a little bit of the third year vet students, and we teach them all the clinical skills that they need to know before they get to their fourth year. So it's kind of come full circle for me in a way. And I remember when I was a tech student in the very beginning, learning all of these skills, thinking like how hard it was. And I didn't really have, I mean, we had our instructors, but that was it. And she was kind of intimidating. Sorry, Dr. Ballard, but she was kind of intimidating. Um, and so I really feel that I can help not be so intimidating, I guess, learning all of these skills because there's a lot
Yeah.
skills
Yeah.
to teach.
And I'll just say, having been taught by Miranda, I mean, I had been at UGA for probably 5, 6 years before she came along. And so I'd been here, so I knew how things operated. The skills that Miranda taught me were like bar none. You know what I mean? Like
Yeah.
the
Oh,
stuff that
I know.
the stuff that my
I
you have
know.
experienced it.
I have like a whole list of things to text Miranda that I did, and I
Yeah.
got compliments from, I just
Yeah.
finished an externship, and they were like, "Wow, you must be so ahead of your classmates." And I'm like, "No, I'm not. Like, we have all done these
But you
things.
are.
We have all done these amazing
Yeah.
things, like
Yeah.
ultrasound guided
Yeah,
cystocentesis, like on a cat that has a bladder the size of a walnut. Like,
Right.
these are
Yeah.
like really, really cool things,
Yeah.
and did sutures for the first time in a dental and got to do all these like cool things. And I'm like, yeah, it's not just because I worked as, an assistant for a year before vet school. That's definitely not it. It's truly because I've learned them through our clinical skills curricula, and Miranda's a huge, huge part of that. I go to Miranda more often than not to ask so many questions, and just she is such a reliable, kind, very open individual who is always willing to help and always there to help. And literally any hour that I go into the clinical skills lab, she is unfortunately, but fortunately there. I'm like, why do you and Dr. Wheat, like, why do you guys never go home? Like, why are y'all here? It's super early in the morning or it's like late afternoon. Like, I don't really know what y'all's hours are, but they should be cut down because y'all are always
It's
here.
a drop down bed in our
I know. I
office.
just, all
Yeah.
the time.
Yeah.
Crazy. Well, that's amazing. And, as I just rambled on about, but I just want to say, even having technicians in the education space, it's so valuable, especially for veterinary students in my position. I've experienced Miranda for 2 years in the clinical skills lab, and we have other technicians in the clinical skills lab as well. And, it's very rare that you say, go ask one of the doctors. That's not my cup of tea, but you more often than not, like you are there to help teach us through and help us through so many aspects of the things that we need to be able to do on the day-to-day basis. Clinical skills and obviously your education, but clinical skills are the basis of your practice every single day. And so you need to be confident and competent. And so just hearing your own story of feeling like you had imposter syndrome yourself in this space, that makes me so sad. I want to come give you a hug. And I'm so glad that yes, we're so strong and battled through and prevailed despite, feeling that way, because I cannot imagine my educational experience without having you there and, future students having you. So that just, I'm so glad to hear that, you finally feel, like you're truly making a difference in the educational space, because you are. So
And
that's
that's another thing too, is like I feel like I have done more in my short 2 years at clinical skills than I did in my 8 years at CPC. Like, yes, it is an operating business. So we had to keep up with appointments and certain aspects of GP. So, and in some cases, like we didn't have all of the time in the world to sit there and be like, okay, I'm gonna let you have a sixth attempt on this IV catheter, this dog, that we need to go into surgery because
30 minutes ago.
we've gone through all limbs and
Right.
now
So I feel like I feel like I've done more. I've been able to help more and make a bigger impact, really. That's how
yeah,
I feel.
good. I'm glad you feel that way, because I feel that way too. Lindsay, you kind of spoke to your unique background in behavioral medicine a little bit. I was wondering if you can share a little bit more about kind of your role in behavioral medicine. I know you spoke to what got you interested in behavior in the first place, but kind of what maybe what your day-to-day looks like and really what your role in behavioral medicine is.
Yeah. So behavior med is essentially psychiatry for animals. They have thoughts, feelings, diagnoses that can happen that are on the mental health spectrum. So as a behavior medicine technician, I really focus a lot on the mental well-being of the patient. So part of what made me realize I didn't want to be a vet was actually working at a boarding kennel and like seeing all these dogs that would come in for the first time and they were really afraid, right? And so I found that I had this little knack for helping them feel comfortable and come out of their shell and whatever else. And that's always kind of been my thing, is seeing that this animal is uncomfortable. What can I do to make it better? And then when I looked at these bear cubs and I realized, wow, you can have a bear like stand there so you can poke it with a needle. That's amazing. I can't even give half the dogs that I've worked with a vaccine. So I was like, okay, there's got to be this. Then I was learning about cooperative veterinary care, right? So this is all about what large scale zoos do. Is you have like a gorilla and he's like, yeah, sure, take my blood. And you're like, well, how did you get there? And it's all about learning theory and everything else. Like how do they feel? How is this presented to them? The biggest issue that we have is I can't talk to them. Well, I can technically talk to them, but I can't converse with them and be like, this is really scary. And I understand that. And it might hurt for a second, but it's not going to be forever.
Yeah. And this is for your benefit as well.
It is for
Like,
benefit.
if only they understood that it was truly for their benefit
Yes,
to mitigate pain or
right.
suffering in the future. Oh my gosh.
Yeah, I know. And like, I really do love you, even though I'm stabbing you with a needle.
Yes.
Right? Yeah. So the way I like to teach students like how and why behavioral medicine works is I am an undisclosed aged adult, and I, from childhood, have been terrified of the dentist. Okay. I have very sensitive teeth, so that's probably part of it. I had lots of dental problems as a kid, no fault of my parents, just the luck of the draw. And now, at my undisclosed age, I will still go into a dental office. And if I'm getting anything done other than a cleaning, immediately start sweating. My heart rate goes up. My skin flushes. I start doing these weird tics with my body that are just like displacement behaviors. And I just recently, in the last couple of years, had a dentist go, would you like some psychoactive drugs to help with that? And I was like, dear God. Yeah. Finally. So if I, as a human being with a high functioning cognitive ability, cannot make myself calm down at the dentist. Like, this is also why I'm not like huge into dentistry and vet med, because you turn that scaler on and I'm like, oh no, oh no. It's just, and so that tells you too, like mentally how important experiences are, learning, understanding everything. So a lot of what I do is trying to help facilitate care on many of these animals. So in my actual service, it's me and one doctor who is a diplomat of the American College of Veterinary Behavior. She and I, through a history form from the owner, records from the veterinarian, she diagnoses the animal with what is the problem, or the concern, I guess, because it's, can't call it a problem, it's valid. And then the treatment for that. So sometimes that includes psychoactive medication. It includes very particular management depending on the behavior problem of the dog. So I would say the biggest thing that we see is aggression, but that's a very umbrella term, right? Like aggression is kind of the clinical signs that they show, but like, what is it based out of? Fear, stress, anxiety? Is it impulsive? Is it whatever? We see separation anxiety. We see generalized anxiety. We see certain phobias such as storm phobia.
Sorry.
So then we come up with a treatment plan. So management in the household, then exercises that are behavior therapy exercises, which and sometimes looks very much like training, but in reality, all of these things have a very particular reason why. So if I want to teach your dog a leave it cue, it's not just because I don't want them to touch something, it's because they're obsessively looking at another dog barking and lunging, and I want them to divert their attention elsewhere. So in my service, I do a lot of that. I teach a lot of the behavior therapy to the patients and the owners. I help talk over management. So then we go through this process with the clients in the initial appointment, and then we do a lot of follow-up. So I'm the primary form of communication with these clients, ensuring that their treatment plans are going as they're supposed to, if they have any questions, whatever else. But then my service is only part-time. So the rest of my time of my job, I'm spent as a floater. So I'm cross-trained in every area of the veterinary teaching hospital. So I can fill in where needed. But the best part is when we get these animals in that are very afraid. I mean, I just did it today. There's a cat here that's very afraid to be here that needed to be sedated. And how do we handle that? Because he's actively swatting and lunging at us.
Right.
So I talk a lot about compassionate, lower stress handling. There's no reason to wrestle, scruff cats, none of that. That's very scary. It's not helping the situation.
Yeah.
Because if we do that, then they're going to come back and go, oh, it's you again?
Yeah.
Absolutely.
I remember.
Yeah. So I really, my tiny little niche passion is teaching handling skills that are more compassionate towards the animal, right? Like they're terrified here. I love them very much. That's why I'm doing this job. They quite frankly don't understand and they don't care because I came at them with a needle last time, or they came in limping, so it hurts. So everything that I do is really focused on the mental well-being of the patient, whether that's, hey guys, this is just not going to happen today. We need to send them home with some medications to help them feel more calm and then try again. Or this dog is a bite risk and that's okay because that's all they can say to me that says they're uncomfortable. Maybe we can talk about cooperative muzzling so that that's one less scary thing I have to do. So I try and find ways to mitigate when these fear responses happen and aggressive responses happen. So I'm partly very client communication oriented with my service clients, but then I also help by others offering services to other areas in the hospital of handling these animals and helping keep them calm and get them sedated safely and talk about how can we not do this again in the future and make it better for them overall.
Yeah, that's great. And I think a big thing here is like some of these patients that you're experiencing have comorbidities. And so they're not just seeing you, they have to go to their general practitioner or they have to go to other specialties or services in the hospital. And so how do you manage them when they're not with us? Or can we help them feel more comfortable? And so it's not just about, helping the patient, but also education, as you're kind of saying, scruffing cats has been the gold standard of care for cat or, managing cats for however many years. And we're moving into the fear-free space, but still, you see it. And so having that open line of communication as well with others and owners and helping owners advocate for their own pets, I'm sure is a big thing that you do as well. So that's awesome.
Big,
Really,
big,
really cool.
big advocating over here. Yeah.
Yeah. I
Love
love it. I
it.
love it. Well, that's awesome. Well, thank you both so much. Just kind of finishing up, I wanted to see if either of you have any advice for any students who might be thinking of pursuing a career as a licensed veterinary technician.
I thought when I got this question, when I read it, I was like, what would I want to know when I was in that phase? And I didn't have anybody to ask. Thankfully, I did what I did and it got me in the door. But I really do think if you have no idea, or even if you think you have an idea of what route you want to do, go volunteer. Find a shelter, a humane society, a clinic, animal hospital, whatever you want to call them. Find them and reach out and see if you can shadow, volunteer, part-time job, kennel, whatever it may be. And I feel like find different ones too, because you really do need to find, because some of them are just going to have one doctor, one tech, and one receptionist.
Yeah.
And that's it. And that's totally fine. And it works for them. But then on the flip side, you might find a vet that's a multi-doctor practice, boarding, kennel, grooming. They do specialty or not. They do a lot of surgeries. They see a lot of rooms. And they've got a full staff. They've got RVTs, LVTs, assistants, kennel, tech assistants. They have it all. And so I feel like find as many different places as you can to get into and at least see. And hopefully you'll be able to see the different roles, the different jobs, and then that will help.
Awesome.
And I'll tag on saying kind of when I found out about licensed vet techs, I always wanted to be the person that they trusted. So I always worked very hard at the boarding kennel, at the other vet clinics I've worked at the zoo. To me, gaining an animal's trust who cannot communicate their feelings to me with words is honestly the biggest honor I've ever had in my career. There are several patients that we see in primary care at the hospital, and quite frankly, there's an alert on their record that says, "Hey, call Lindsay."
Yeah.
That the fact that these animals trust me is so huge. And so for me, that's what really led me to doing this is I could be the person that they trusted. I was also, I feel like I'm a pretty outgoing person, but when it came to figuring out what to do with my life, I didn't ask enough questions. And so I think really you need to ask questions. There are, I mean, luckily in the state of Georgia, we have so many options. You know, we have small rural private practices, mixed animal practices, farm practices. We have Atlanta with tons of specialty clinics. We have University of Georgia. Go ask questions, reach out to people, go and shadow. You know, like the first time I watched a space surgery, I was like, oh,
Yeah, no, I don't want to do
I
that.
don't know if I want to do that. Like,
Yeah.
not that, I mean, my own blood queases me out, but that didn't, I was just like, that does not look like fun. That's just
Yeah.
a lot of squish in there. I don't think
A
you
lot of
know,
squish. And I have to
a lot
start
of
figuring
squish.
out
It's
what all
like,
that squish
yeah,
means.
it
So I
gets
better figure it out.
it
Yeah.
just really didn't get my engine going. You know what I
Yeah.
mean? What got my engine going was sitting with that, and it's still to this day, getting the animal to eat, being able to place their catheter without pain, advocating for them to the doctor, you know, your technicians. And this is how I explained it actually to my cousin's child is trying to decide, does he want to go to vet school or tech school? And he loves the nursing care aspect of it. And I told him, I said, you are going to spend more hands-on time and hours with that animal than you will as a doctor. The
100%.
doctor comes in, does their thing. It's just like in human medicine, right? Like you remember your hospitalizations as a human based on the nursing care that you provided,
100%.
not always the doctor care that you provided. You're like, yeah, sure, I'm feeling better, but man, that nurse, she got me that extra blanket. She
Yeah.
didn't put ice in my water. You know, it's little things like that. And so go out and ask questions. You don't have to specialize. You don't have to work at a big university or a big referral hospital or anything else. But if you want to do it, go find out what's your niche, what drives you to wake up every morning and say, I want to do this every day. And
Yeah.
it takes people a long time. I mean, I graduated high school 15 years before I became licensed. So it took me 15 years to reach where I'm at. I don't regret any of it. I loved every single part of it. Do I wish I'd gotten here a little faster so I could have like established myself? Yes, but like I would have never done this.
Yeah.
Yeah.
You know, everything happens for a reason. But ask questions. Never, I mean, I think that's also another thing with us working in education is we get asked questions every day. And only like once or twice have I been like, that's honestly a very dumb question. But most of the time they're all very good questions. And I love when students reach out, and I've had several undergrad students reach out to me and say, hey, I'm thinking about pursuing vet school or this, that, and the other, and this interests me. I'm always open to talking to people. And I think reaching out to anybody is beneficial for you because I mean, it took me a very long time to figure out what I wanted to do with my life. Like, you know, I didn't graduate high school, go to school for 4 years. I didn't do that track. It took me a long time to get here, and that's okay. Everybody's path is different. And so don't feel pressured to go. Like my dad always will go to vet school as a backup. No. This is not a backup type job, right? Like,
Yeah.
unless you're paying for it, like
Yeah,
this is not
for
a
real.
backup job.
Yeah.
And it took a really long time because for, you know, so many of our parents, it's like, well, I want my son or daughter to be a doctor. Like they see this doctor thing, and I'm like, but there's so much benefit. Like we all work together.
Yeah.
And so
We all work together. Yeah.
we have to all work together as a team. And so find, if animal care is what you want to do, go find what part of the team calls to you.
100%. That's amazing. Thank you both so much for sharing your perspectives and, you know, personal anecdotes about your own experience. This has been amazing for me. I mean, I like could sit here all day and listen to y'all. Is there anything else that either one of you wanted to share? Anything that maybe we didn't touch on, or anything else that is really pressing you that you would love to share and have out there?
Um, I think if you love animals, you're going to find your niche, right? Vet med may not be it, and that's okay. And if it is it, then what part? I know people who are, they want to look at a microscope all day long. ClinPath is their passion.
Yeah.
It makes
For
me
them.
motion sick.
Yeah.
Yeah, good for them. Makes me motion sick, literally can't look at it, you know. So I think just find what calls to you. You know, listen, figure it out, take your time.
Mhm.
Really, that's it. I mean,
And don't be afraid to try new things
right.
either.
Yeah.
Because like I said,
I made her
never.
apply for this job.
Yeah. No, I never thought that I was good enough. Like I never thought going through my tech program, oh yeah, I ace every exam. I feel super confident. I'm good. I can go and teach it. Never have I ever thought that I could do it. And she definitely pushed me.
I almost had to fill the application out for her.
And it worked. And so just don't be afraid. Don't second guess yourself. Just try it.
Put yourself out there.
Yeah.
I love it. Great advice. Thank you both so, so much for taking some time out of your day and your busy
Of course.
schedules to share about your experiences and kind of what your roles have been and how you've grown within the field. I appreciate it. I know other students are going to greatly appreciate it. And I thank you both so, so much.
Of
Yeah.
course.